Hello there. I'm Dr. Yeleti, Chief Physician Executive here at Community Health Network. There's been a lot of work going on vaccinations in the past several weeks. I want to give you an update on the current knowledge that we have so far to make sure that you keep informed on what's going on for your own protection and the protection of others. First and foremost, we need to step back and think about COVID. COVID is still a very dangerous disease to get. And while there's some treatments out there, there are not many treatments that are FDA approved. We have a handful in our arsenal. There's a lot of work out there, a lot of words being used about can I do this or can I use that. What I recommend is do not take anything unless your doctor says it's okay. And so be careful what you hear out there because there's a lot of treatments that are not approved and may not be safe. So if you have any question on what to do for treatment, go to your doctor first and ask him or her what they think they need to give you for treatment. Getting to vaccinations. Vaccination is very, very exciting. This really brings hope to us that we could actually see the light at the end of the tunnel for COVID and for all of us. What are vaccines? The current vaccines that are actually out there are what's called mRNA vaccines. They're not COVID parts, so if you take the vaccine, you cannot get COVID. There's no particles to it. It does not alter the genetic makeup of your body at all. It is a piece of what we call genome, but does not affect your own genetics whatsoever. So very, very safe and phenomenally successful. On the horizon, probably in the next several weeks, we're going to have more vaccines come out. We're waiting for the FDA to look at the results of those and see if they're safe for approval. It looks promising, but let's wait to see what the FDA says before we make any comments on the efficacy and the safety of these vaccines. Preliminarily, they look very promising, but let's just wait and see, and let's continue to give the Pfizer and Moderna vaccine that we have to date for each and every one of you. Several people might still wonder, well, is the vaccine safe or not? Do we have enough data on the vaccine? Well, honestly, the vaccines have been around for less than a year, so we don't have safety data for more than a year. And so we do need to understand that we don't know what the safety of the vaccine is after 1 year. However, what I can tell you is we do know the dangers of COVID even after a few months. So even young people of any age, they do have long-term symptoms or long-term sequelae to the body. People can get heart damage, lung damage, brain damage, get chronic fatigue. So there's a lot of side effects of COVID, regardless of how healthy you are when you get COVID. So while I can't say we know every single side effect of the vaccine, I can say we know a lot of the side effects of COVID, and you have to trust me that none of those side effects are something you want to get. So when you're debating if you want to get the vaccine or is it safe, debate, is it safe for me to get the vaccine or is it safe for me to get COVID? And I think that's the question you have to ask yourself. And as always, reach out to your healthcare provider. Your physicians and your APPs and other people can actually help navigate what's right for you on an individual decision. Some people ask, is it safe to get the vaccine if I'm pregnant? The national organizations have said it is safe, again, because getting COVID is very dangerous if you're pregnant. But honestly, at the end of the day, go talk to your obstetrician or your primary care physician and make individual decision on what's best for you. Is it safe to get the vaccine or is it okay to wait and see if you get COVID? And it does vary person to person. Now, there's a lot of nervousness and anxiety about the new variants that we're seeing coming around the world. How is that going to affect me? What do I need to do differently? Should I still take the vaccine? First and foremost, I would emphatically say get the vaccine regardless of the variants. Again, when we talk about a vaccine being 95% effective, that's great. You got to realize, though, in medicine, anything above 50% we get very excited about. So we do know that the current vaccines are at least 50 to 90% safe for every variant that's been known out there. So do not wait for a better vaccine to come out. If you're debating a vaccine, I would get it right away, regardless of the variant. Some of you are wondering, well, when can my children get vaccinated? And is it safe for children? Well, 2 points about that is that the current vaccine studies have not been evaluated in children less than 16 in some studies and less than 18. So at the moment, we don't have any data to show the efficacy in children, so we don't recommend it in children. Also, it's important to remember is that right now, the main goal of the vaccines is to reduce deaths in the entire country. So we want to make sure we really vaccinate all the elderly, all the high-risk populations. Will children get it? They will at some point. But right now, our focus is to reduce the deaths from the COVID-19. So that's what we're focusing it on. We don't have data for children yet. Let's wait a few months, and later in the year, we'll know if it's safe for kids to get it. But the short answer right now is the kids should not be getting the vaccine until we have more scientific data. Some people are asking, well, should I wear 2 masks or should I do something differently because of the variants? They actually don't need to. The most important thing is to wear a mask that fits and fits correctly, that really is tight around your nose. A bandana doesn't do that. But if you wear a mask that truly fits around your nose and mouth, one mask is adequate. A lot of people don't actually realize that, so it's very important to wear it, but wear it correctly, regardless of the variant, regardless if you take a vaccine or not. Which brings another question. If I take the vaccine, do I still need to wear a mask? The answer is yes. The reason is the vaccine is meant to prevent the illness from getting to you. It doesn't mean you won't get the infection and you won't infect others. So it's important to remember that you're not going to get ill from COVID if you get the vaccine, but you still may have the infection. You still may give to somebody else. So I would still caution you to take the appropriate precautions and wear the mask even after getting the vaccine. It does reduce deaths. So why am I so excited about the vaccine with all these limitations? In the past couple months, we've seen thousands of Hoosiers die due to COVID. With this vaccine, that number is going to go from thousands to hopefully hundreds to hopefully zero very soon. And we won't get any more people hospitalized in our hospital. So there's a big ray of hope. And hopefully in the next several months to the next year or so, we'll see things getting a little bit back to where we want it to be. Maybe not completely back to normal, but certainly in the right direction. At any point, though, if you have any question about the vaccine or its safety or is it right for you, reach out. Don't stay at home and wonder, but reach out to somebody, reach out to a healthcare provider to see if it's right for you or not. Thank you very much.